Hi class, it's Jamie Batch, your instructor for A&P1. A few of you had asked me to create a video of the skull. I'm not going to do this for all of the parts of the body and all of the bones, but I will do it for the skull because the skull is particularly hard or difficult, I should say, and I want you to be able to master this without too much confusion. So that's why I'm going to make this video for just this one part, okay? And I have the practical to list in front of me, so literally what I'm going to be doing is just going down the list in front of me. So what you might want to do as you're watching this video, have your practical ID list in front of you, maybe have a few diagrams of the skull in front of you, or if you're in lab watching this, have the skull in front of you in person, and pause the video frequently so that you can identify the structures as I'm going through them, and then stop the video and quiz yourself, kind of like how we did in lab, because you really want to make sure that you're soaking it all in and not just saying, okay, I got it, right? You need to physically pick up a pipe cleaner, stick it in the hole, look at it from this way and all the different ways to make sure that you understand how this works and how it's all put together and where everything is. Sound good? So we'll start with the beginning. The skull that I grabbed just happened to have a big old hole in the back of his head. So that hole is right where the occipital bone is. You can kind of see the suture line for where that occipital bone would be. So the occipital bone is here. It's actually underneath as well. So where that big foramen magnum hole is, that's also through the occipital bone. So on either side of your, and this is one of the problems with doing the videos. I'm just going to put that down. It is really hard for you to see the three-dimensional context that I'm speaking about. So again, pause the video, ask me questions if you need it. These are the occipital condyles on either side of the foramen magnum. Then you have the external occipital protuberance, which is this little notch. You can kind of see it right there on the occipital bone. It's also called the inion, probably easier to spell inion than external occipital protuberance. Pick your poison there. And then you have the hypoglossal canal. The hypoglossal canal is this little hole that's diagonal just underneath of your occipital condyle. So I'm going to stick my pipe cleaner through both hypoglossal canals so you can see where it comes out. Some of the models will have a hole on the occipital condyles. This one doesn't. The hole that's on the occipital condyles, it looks very round and almost perfect, is a hole for the model. It's where the actual skull screws into the rest of the skeletal model. So don't confuse the hypoglossal canal with those already pre-drilled holes. The hypoglossal canals, as I told you, are kind of hiding underneath of the occipital condyles. You can kind of see them from that angle. You can also see them from the inside where they are, the foramen magnum, and then those hypoglossal canals are just small holes off at a diagonal below that. And if you think about where your foramen magnum is, right, it's kind of in your throat area. The hypoglossal canal is for your hypoglossal nerve, which innervates your tongue. So it kind of makes sense. All right, let's move on to the parietal bone. There are two parietal bones. There is a parietal bone on either side of your head, left and right. It is split down the middle, or they are split down the middle by the sagittal suture. You have the coronal suture that separates the parietal from the frontal. You have the squamous suture, which you can't even really see on these models. It's kind of very, very, very faded. It's one of the first sutures to form right after birth. So it's very smooth suture, the squamous suture between the temporal bone and the parietal bone. And then the lambdoid, you can see it here and here. The lambdoid suture separates the occipital bone from the parietal bones. So those are your sutures that are associated with your parietal bone. There may be a fetal skull on the practical. It will look similar to the pictures that are in your lab manual, and I may ask you what the suture name is for those areas. So you may see the sutures on your practical on an actual skull or on a fetal skull, so make sure you can identify them either way. On the frontal bone, I don't have a sinus model here with me at home, but the frontal bone, right, is your forehead bone, and you have your frontal sinuses, which are inside. When you look at these sinus models, you'll see a sinus right here. It's kind of a small cavity. That is the frontal sinus. And then the supraorbital margins are your brow ridges, which with the lighting, it's very hard to see. But there's a difference between where your eyebrow is and where your frontal bone is. I'm just going to take this off. So that is your supraorbital margins, basically where your brow ridge. It's that difference between your frontal bone and the top of your orbit. If you feel on yourself, you can feel how it kind of sticks out. That's your supraorbital margin. All right, when we look at the temporal bone, if we look at the squamous region of our temporal bone, which is the outside, you'll see a couple different features. First, the zygomatic arch is composed of the zygomatic process, which comes from the temporal bone, and the zygomatic bone itself, which is one of our facial bones. So we'll talk about the zygomatic bone in a second. So the zygomatic process of the temporal bone is here. And you should have, like I said, you should have a diagram in front of you of the skull itself so you can see exactly where these boundaries are, because you're not going to be able to see all of the boundaries on the skull model itself. So the mandibular fossa, if you look at the inferior view, you'll see the mandibular fossa is just underneath that zygomatic arch. It is literally where the mandible, which is on the right and left, it's where the mandible fits in. And if you're having trouble finding it, grab the mandible and try to articulate it, and it will fit right nicely in there. That mandibular fossa. Boop. A fossa is a shallow depression. So the mandibular fossa kind of locks in there. The mandibular fossa is where the mandible articulates. Okay, so that's the squamous region. The tympanic region has the external auditory canal, that little ear hole. On our models, it does not go all the way through, so you will not be able to, you'll not be able to stick your pipe cleaner through that hole. It kind of gets stuck, kind of like a Q-tip, right? That's your external auditory canal. You can also call it the external auditory meatus, any combination of those words. I believe external auditory canal is the easiest to spell, and since spelling counts, that's what I would choose if I were you. There's also the styloid process. The styloid process is this vampire tooth that hangs down on both sides. It is a very pointy, can't really see it from this view, a very pointy structure. There it is, this guy, sticking off. This is for muscle attachment in your vocal cords and such. In your pharynx and larynx area. All right, the mastoid region has the mastoid process, which is the massive protrusion. So you see, and again, with the lighting, it's hard. So you see your styloid process right next to it. There's a big mountain, which is the mastoid process. Mastoid process on both sides. That's the mastoid process. The styloid process is the little vampire tooth sticking out. In between, you can see here, in between those two, somebody has colored with a green pen the stylomastoid foramen, which is right in between those two holes. It is those two, those two processes, I should say. It's an incomplete hole, so you won't be able to stick your pipe cleaner all the way through it, but that is the stylomastoid foramen, which is just a site for blood vessels to pass through. It is right in between. So here you can see the mastoid process and the styloid process, and right in between is a little guy. That is your stylomastoid foramen. The petrous region has the jugular foramen. This is looking inside the skull, right? So not at the roof of the mouth. This is where the brain would be. And when you look at it from this view, you see the jelly bean. That's the jugular. The bean-shaped hole. This guy. This whole thing is the jugular, and there's one on the right and left, the jugular foramen. The carotid canal is in there as well. Why do I keep losing it? Oh, because it's always on this side. So you can only see the carotid canal from the inferior view. The carotid canal is another way that these blood vessels enter. The carotid canal is the deeper depression next to the styloid process. So you find your styloid process. Find your styloid process. Next to your styloid process is that jugular foramen, the big jelly bean, and then just above the jelly bean is the carotid canal. It's an incomplete hole right above your jelly bean. So here's your jelly bean jugular, right above it, right there, boop, boop. That's your carotid canal. Got it? All right, if you don't, pause it, go back and listen. internal auditory meatus is just above the jugular on the inside. So here you have your jugular, and your internal acoustic meatus is another incomplete hole. Right there, I'll try to show you. So there is the hole. See, it's kind of green. Someone must have used a green pen on this. So you can see the hypoglossal canal right there, our jugular, and our internal auditory canal, or internal acoustic canal, whatever you want to call it, doesn't matter. That is our, where am I on this list? Okay, so that's the petrous region of our temporal bone. Boom. Then we do the sphenoid bone. To find the sphenoid bone, we look at the inside area where our brain would be. The sella turcica is this whole saddle area in here, this whole region. In the middle is this depression where you can almost imagine sitting. Oops, don't mean to put that in the hole. This little saddle. Look, I can almost like hook my pipe cleaner on the saddle. Look, riding on the saddle, right? That little shallow depression is the hypophyseal fossa. That's where your pituitary gland sits. We'll learn all about that in the next couple of chapters. There are the lesser wings of the sphenoid, which are up here. They're the smaller wings, and if you're looking at a colored diagram of your sphenoid bone, you'll see those are the lesser wings, and down here are the greater wings. The greater wings, they're bigger. And if you look at our brain case like this, it almost looks like here's like the bottom level, and then there's a step up to this top level. So the top level is where your lesser wings are. The bottom level is where the greater wings are. There are also sinuses of the sphenoid. They're very small, and they're, if you were to cut our brain off or cut our head at a sagittal section, you would see them in there. They're kind of medial, and they're lateral to our frontal sinuses, but they are medial to the ethmoid sinuses. You'll see it on the model in lab. There's a sinus model that is stored in the lab room, and then there's also a frontal and sagittal section model where you'll be able to see these sinuses as well. So just ask, because I don't have those. I didn't bring a whole collection of models home with me. I only brought this guy. So I'll make sure I point them out in lab as well. Let's see what else. Greater lesser wing sinuses, optic canal. So the best way to find the optic canal is look in the back of the eyeball, and you'll see a little hole back there. That is your optic canal. It's not the big slit, it is the hole. It comes at an angle into your sphenoid bone, just like that. And so there's one on the right and left. The other one's right here. You can see it just there at the tip of my finger. Those are your optic canals. They're the little holes all the way in the back of the eye. On your practical, I will literally have the pipe cleaner sticking through the hole, and the pipe cleaner will be numbered, and you'll have to identify the hole. The question will literally say, name this hole, and it'll be like this. And you can look at it, you can pick it up, you can move it around to figure out what that structure is. Okay. Moving on with our sphenoid bone, you have the superior orbital fissure looking in the back of the eye socket. You see the structure has a V, almost a sideways V. So here's a superior fissure. Here's an inferior fissure. So this is called our inferior orbital fissure. This is called our superior orbital fissure. So the superior orbital fissure is the top part of that V in the back of the eye. It's hanging out just underneath of the lesser wing of the sphenoid bone in our brain case area. See it? And you can see it from this way. That's the superior orbital fissure. All right. Inside this area, you also have 3 holes. Let's name them. So the big one that's easy to recognize is the foramen ovale. That's the big oval right here. This guy. This big one towards the middle is one that you don't have to know. That's the lacerum. So this is the ovale. This one is the spinosum, and this one is the rotundum. Foramen rotundum, foramen ovale, foramen spinosum. Rotundum's up there underneath. You can kind of see it, this little guy. Doesn't go all the way through either. Rotundum. Okay. Ethmoid bone. The ethmoid bone is this weird area right up here, just above the lesser wing. So this has on it a sella turcica. This, I'm sorry, does not. This has on it a cribriform plate. The cribriform plate is this little piece that kind of sticks up. I know my lighting's kind of weird, so this thing that sticks up in the middle is our cribriform plate. This right here, this very middle piece. This cribriform plate. The cribriform plate is part of the crista galli, which is this whole structure. So these little indentations and the cribriform plate are part of the crista galli. There are middle. So the ethmoid bone is also in our nose. So if you look at where this is, if you just go right below, it's inside of our nasal cavity. So that's more of the ethmoid bone in there. And you can see the middle, this, and the inferior, this, nasal concha. So there's a right and left. So the inferior is the bottom, little loopy swoopy inside the nose. And then the middle concha are the top loopy swoopies inside the nose. There is a superior, but it's way up in there and you can't see it from the outside. So your middle and inferior nasal concha. The perpendicular plate is this whole septum. It's called the perpendicular plate. The perpendicular plate comes down and meets with another bone called the vomer. It's another little bone in there called the vomer. So the vomer and the perpendicular plate of the ethmoid bone, which is this kind of top piece of the septum, that is what makes up your entire nasal septum. So it's two bones. And sometimes those bones get shifted a little bit or crooked. Maybe someone punches you in the nose, knocks them off, then you have what's called a deviated septum. Have you ever heard of that? Maybe you know someone that has it. All right. We did the nasal bones are these two bones right here. That's the bony part of your nose. You can feel that from the outside, and then the rest of it is, of course, that cartilage. Moving on, lacrimal bones. There are two lacrimal bones. They're very, very small. They're on the inside part of your eye. It's hard to see with the lighting where those suture lines are, but on the actual model, you'll be able to see a little tiny bone right inside the eyeball, and it's right near this little duct called the lacrimal duct. So, what else? There are your zygomatic bones, which form the bottom or inferior portion of your orbit. That's what these are. They form the anterior portion of your zygomatic arch. And we have our maxilla, which is the top or the roof of our mouth where our teeth are. And on the underside, you have a palatine bone. The palatine bone is the back of the roof of the mouth. So if you're looking at a color-coded diagram, you'll be able to see it very well. It's really this back part right here, kind of behind this little spring area, is the palatine bone, or the palatine process of the palatine bone. There is an infraorbital foramen, which is this guy right here, the foramen below the eyes. Infra means inferior, orbital, right? Inferior to the orbits, foramen as a whole. So it's the foramen right underneath, look like little dimples there, right underneath the eye socket. And then I already pointed out the inferior orbital fissure, boop, boop, just the bottom part of that V in the back of the eyes. Palatine bone I noted already. Let's look at the mandible, our jawbone. So the mandible has a mandibular angle. That's just the angle right here, kind of your jaw angle at the back of your mouth. The mandibular ramus is this whole piece, right? So your mandible is this, and then the ramus is kind of the arm that's coming off of the mandible, reaching up towards that mandibular process. This is the mandibular ramus, this whole flat piece that comes up, and there's, a right and a left. The mandibular notch, there's a right and a left, mandibular notch. The coronoid process, this little extra guy. This extra guy is your coronoid process. The head of the mandible, or the mandibular condyle, that's the piece that articulates with your mandibular fossa. The very back side of your mandible. Trying to give you all different angles here. These guys. And your mental foramen. Remember mental? The mental foramen, the little holes, there's right and left that are on your mandible. All right, the fontanelles are listed there on your study sheet for you: anterior, posterior, sphenoidal, mastoidal. They're actually pretty easy to see, and they would be on the fetal skull or a picture of a fetal skull on your practical exam. And that covers the skull. So let me know what questions you have. I'm not going to do videos for any of the other bones. There are plenty of videos out there in YouTube world and or your PAL and other practice things. The skull is the hardest part, so that's why I wanted to at least make a video for your study purposes. But that's the only one I'm going to make. Don't even ask about other ones. You're lucky you got that one. All right, guys. Have a good one. Thanks for watching. Bye.